Hello everybody, it's Dr. Eric Kelly again, and today we're going to go over your cervical part of your rehabilitation. So these are the exercises that I'm going to want you to do at a very specific part like we talked about in the first day. This is going to help to strengthen the ligaments, tendons, and muscles around the subluxations in your cervical spine. This is going to help prevent future damage. It's going to also help stabilize all the hard work that you've been doing so far with the Dental and the stretches and so forth. So we're going to be going through different color bands as we work through this. The yellow one is what you generally start with. Then when that gets easy at 3 sets of 15, we're going to move to the red one, and then we would generally then move you to green. I always like to say green means go. By the time you get to the green band, your neck should be very strong, probably stronger than you've had it in many years to decades, actually, if you walk through this properly. So bear with me here now. We're going to jump over and I'm going to show you exactly how to do these exercises. Just remember, slow and steady wins the race. All right, so we're going to start now with the resistance band part of the exercises. So the yellow band that you'll have, you can tie it to something head high. You can either use like a door handle, you can sit on a chair and do it in front of the door handle, or you can tie it to like what I have here. I have something that's almost my head height. So you could have something here on a banister, so by your stairs, tie it there. But it has to be head level for you to have the proper angle of the pull on it. So I'll show you here what I would do is I would just loop it around, tie a little knot onto it, and that's it. And then I would have it hanging there. Now when you do these exercises, you're going to do 4 ranges of motion. You're going to do cervical flexion, extension, and lateral bend. So I'm going to demonstrate how to do the flexion first. So what you'll do is you'll take the band, you'll stand in front of it. Now you're going to want it opened up all the way across your forehead for a very specific reason. If it's all balled up, it's actually going to just roll up and pull through your hair. So the females will always have a lot of trouble with the hair being pulled out, so we don't want that to happen. All right, so with the hand here, use the band there, you step forward, so there's a little bit of tension onto the band, so you're starting to feel a little bit of a pull on the neck as we start. And nice and slow and steady, like I mentioned before, what you're going to do is pull the chin down towards the chest and then back up against neutral. Same speed that you go forward is the same speed you go back. So you don't whip forward and then let the band whip your back. That's actually going to probably agitate your neck if you keep doing it incorrectly. So I just want you to pull nice, steady forward and same resistance back. So that's the flexion. So then all you do is you just pivot your feet, and now the band is tied still in the same position. You step away so that the tension is on the band here, just so that there's a little bit there. You start to feel a little bit of a pull on the side of the neck here. Trying to get yourself neutral, you want your nose, chin, and belly button in a straight line. And from this position, you tuck your ear to your shoulder and back up again. Just a straight lateral bend and then back up again. So don't try to rotate and go down, that's incorrect. I want you to look straight ahead and bend off to the side. Looking straight ahead, bend off to the side. 3 sets of 15 on all of these. So as I'm doing the right shoulder now, of course you'll have to switch over and then do the left. The forward one again is 3 sets of 15 as you do it. Now the last one I'll show you, because this one will be left and right, so you just pivot your feet and turn the other direction, is the extension. So now the band is behind your head. Step back till you feel a little bit of a pull right here, and then from this position you tilt your head backwards and look up towards the ceiling, and then look straight ahead at the point of where it's tied. For safety reasons, if you do have it here, it would be a good idea to hold on to the band so that way it doesn't flick you into the face. That would be a good safety tip for you so you don't get a black eye. All right, and then slow and steady, of course, wins the race. Just nice and even back to neutral, slow and steady back, and then back to neutral again. And you can control the tension by making it easier if you stand in towards the door, and harder the further away you go from the door. But again, you want to make sure that band doesn't hit you in the face when you go ahead and do these exercises. Okay, now that would be the band resistance. So now we'll go over and I'll show you how to do the ball part of it. All right, 1 second. Okay, now on to the ball part of it. So you can use like a ball, like a basketball, a volleyball. I'd always encourage maybe just the actual beach volleyball that you buy from like Argus or anywhere like that, and anywhere that you go, and you just blow it up, and that way you have a little bit of give to it. So I don't have a ball, so I want to show you what you can use instead of a ball. I have in here our foam roller. and then have it wrapped in a towel for a little bit of give, because you want a little bit of give on that resistance exercise we're doing. So now the motions are going to be a bit different. With the band, what you did was this motion, which is flexion. Now with the ball against the wall, you're going to be doing this motion, which is just a straight translation forward and then back again. And it's the same with the side. You're just going to be shifting over. So I'll show you how that's done here now. So with your ball or foam roller tied up into a couple soft towels, you'd place it forehead height against the wall. And now from this position, you'll walk yourself into a good neutral position where you're not leaning forward or backwards. And the positioning of the band, or sorry, the ball would be here. And now what I do is slowly engage, pushing straight in, relax, and come back. Push in, hold, count to 5, and then relax. And you repeat this again, 3 sets of 15, just like the resistance bands work. You just want to push in with the give of the ball. You'll feel that resistance and pull back here, and then back in again. So that's the forward movement. The sideways movement is a little bit difficult to kind of get at first. You want your posture neutral, so you want your nose, your chin, and belly button in a straight line. You want your posture correct. Don't be in like this, because you're going to put a curve in your cervical spine. It's going to cause a lot of tension. So make sure that you're good and steady here like this. Now from this position, once I get myself neutral, what I'm going to be doing is pushing straight in that way against the wall and the ball. So pushing in and then relax. Push in, you should feel this here, and on the other side the exact same muscle, and relax. And you could even feel a bit of a pull up into the side of the skull, just the way the soft tissue and fascia are all connected here in the neck. Holding in for 4 to 5 seconds, relaxing, and then back to neutral again. So that's the left and right, same as the band. You got to do that one on the left side and on the right side. So 3 sets of 15, front, front, side, left, and right. And then the last one is the reverse, so going back against it. So place it again right up on the top part of your head. Have it nice and steady. The dimples not digging into your skull. Okay, try to get yourself in a nice neutral position. And then now this position, basically I call it the ugly chin. You're just tucking your chin in, giving yourself the double chin, and then relax out. Pull in, so you're just pushing straight back in, and then relax out, and then push in. And again, holding for 5 seconds once you get to that position. When you're holding, you'll feel the engagement of the muscles, and then you relax in. So again, this one here, you just push in and relax. Okay, and that's the ball exercises. And if you don't have a ball, lots of times people, if you don't have one sitting around, you can have a foam roller or just something hard in the middle, wrapped with a couple towels, just to give that little bit of push in, that little bit of give. But I'm sure you'll find something. I got confidence, you guys. All right, here's all the exercises. Work away, and if you have any questions, always just ask us. Thanks.